Botox in your neck. That sounds strange, doesn't it? Hey there, I'm Dr. Ray. I'm a board certified dermatologist, and today I am talking to you about the lesser known but totally underrated ways that we use Botox in the face and neck area. Ways that you might not have already heard about or thought about, but that could actually possibly be a game changer for you. So let's get into it. First off, what is Botox? Botox is a neuromodulator. It relaxes the muscles of facial expression or of neck muscles as well. And it is not the only neuromodulator. There are other lesser known neuromodulators like Dysport, like Jeuveau, Xeomin, etc., that do the same thing that Botox does. They are less known because they don't advertise quite as much as Botox does. So Botox is sort of a household name now. Everybody knows what that is. It's like saying Kleenex instead of tissues. Everybody knows Kleenex, right? And just FYI, when I'm referring to Botox in this video, I am also talking about any of the other neuromodulators, okay? But I'll just say Botox. So what does it do? It relaxes muscles. And so the places that we very commonly use it, that you might have already thought of or heard of or already done yourself actually, is in the forehead area to help those horizontal lines across the forehead, between the brows for those 11s or those frown lines, and then around the corners of the eyes, outside of the eye, to help with what we call crow's feet. So those are the most common areas that we use Botox. However, let me talk to you about some lesser known areas that, again, I think could be a game changer and are really nice because Botox is such a low risk procedure. It's one of the safest cosmetic procedures that we do in the clinic. So if you get a little bit of improvement in these other areas of your face or your neck, why not try it, right? So I'm gonna go from higher to lower, okay? So we're gonna start in the forehead, not in those forehead lines, but in terms of the eyebrows. You can get a little bit of a brow lift with Botox. And is it like getting surgery, like a surgical brow lift? No, not necessarily, but it can give you a couple of millimeters lift. How do we do that? By injecting the muscles that pull down the brow, so we can lighten those, we can weaken those a bit so that they're not pulling down so much and they're allowed to lift a bit. So those muscles lie here between the brows. We call these the corrugators. They pull down the medial part of the brow, the inner part of the brow. And then in the tail of the brow, we target this part of the orbicularis oculi, which is a muscle that runs circularly around your eye. We really want to target this outer corner because it helps pull down the brow as well. So when we do that, you do get a nice kind of opening up of the eye, of the brow. And because the brow is attached to the eyelid, right, you can also get a bit of an eyelid lift with that as well. Again, it is not like getting eyelid surgery. Don't expect that, but it is about 1 millimeter or 2 of lift, which sometimes in the eye is quite significant and makes a difference, right? So that's the first area that I love using it, that people don't often know about. And the patients that I do treat with Botox for a brow lift are really happy with the results. They really love that opening up of the eye and the brightening of the face that happens with that. So the second place I love using it that not a lot of people know about is underneath the eye. Now we do think about Botox again very commonly for those crow's feet, which are those outer wrinkles, right? But when you smile, you're not only getting those outer wrinkles, but you're often getting those horizontal lines underneath the eye. And let me tell you something about those. Those are so difficult to reverse once they actually settle in. So one of the ways I like using Botox is to prevent those lines from settling in. So even if they're not really prominent for you when you're not moving your face, if you get those creases, those wrinkles when you're smiling, it's really not a bad idea to kind of start sprinkling in a little Botox here and there in that area. And it really is a sprinkle. You really only need a few units underneath the eyelid. You really don't use a lot, but it helps to relax that lower part of that round muscle that we just talked about, the orbicularis oculi, that's contributing to that horizontal creasing under the eye, so that when you do smile, it's not forming those prominent creases, and then over time, those creases are not allowed to settle in and just be there. I think those creases honestly age people a lot. Like if you see even celebrities, they can have the smoothest face ever, but you look under the eyes and when they smile, it is crinkly. And again, it's because they are so difficult to reverse once they really settle in. So again, if we can get in front of it a little bit with some prevention, it's great. If they're already settled in, it's still not too late to prevent them from getting worse and even soften them a bit, especially when you smile, they won't be as noticeable. And one thing I do wanna warn you about here is that if you have a lot of laxity in that lower eyelid skin, if the skin is kind of loose there, it doesn't snap back very well, you're not gonna have a good result here. It's gonna actually maybe make your eyelid look a little bit more droopy or baggy, that lower eyelid. So I would avoid it in that type of person. Now, how do you know if that's you or not? There's a very simple test you can do. And actually I do this to people in the office too before I treat them if I'm concerned that they might have a bit excess laxity, that they're not gonna be a good candidate. And it's called the snap test. So what do? Really easy. You wanna take your lower eyelid skin with 2 fingers, pinch it up, and if it like snaps back within a second, then you have enough elastin there. It is not too lax, and very likely you'll have a good result with this treatment. But if you do that move, you pinch it up and let it go, and it takes more than a second, like 2 seconds or more, to settle back down that skin, then you might have too much laxity in the skin and you're just not a great candidate for this treatment. But again, it's good to know that before you go in seeking this treatment. Okay, the third place I love Botox is in the jawline. We call this a Nefertiti lift. And what does that do? It helps give a little bit of a lift, a little bit of a sculpting to that jawline. Keyword is, or keywords are a little bit. Okay, so is this like a facelift? Absolutely not. Do not expect that. Very mild improvement. It can be quite subtle. However, in someone who already only has a subtle amount of jowling or like laxity in that jawline there, it can be a noticeable improvement. And when we combine it with other things that help with jowling, like fillers or biostimulators like Sculptra, plus or minus a tightening device like ultrasound or radiofrequency, plus that Botox in the jawline, it can really help augment those results and get an even better result in terms of that jawline snatchness, okay? So how is this treatment done? It's about maybe 5 or 6 injections along that jawline. The reason it helps is because it's targeting the upper part of the platysma muscle. The platysma is a broad muscle that spans your entire neck, and it attaches here at the jawline, not on the bone, but in that tissue, that soft tissue of the lower cheek. And it's contracting, typically it's contracting. So when you are weakening that contraction, it's kind of easing up here and it's allowing that cheek to not be pulled down. So normally it's gonna pull down your cheek. When you ease it up with the Botox, it kind of lifts up a little bit, it allows that cheek to lift up. Again, it is subtle, it's not like a facelift, but it is a great adjunct to other treatments. And when someone has mild laxity, it can be a really awesome treatment. Okay, the fourth place that I love Botox is in what we call the DAO, that's the depressor anguli oris. And that is a muscle that runs from the corner of your mouth up to like the outer part of your chin. And what it does is it pulls down the corner of your mouth. So when is this helpful? As we age and we get a bit more laxity again in the lower face, it allows the corner of the mouth to kind of droop down a little bit. So it's kind of like a permanent sad face. And you might even be noticing a bit of what we call Marionette lines, which are these kind of depressions right here in the outer part of the chin on either side. And if that's the case and you have a bit of a downturned mouth, this DAO treatment can be really helpful. That muscle pulls down the corner of the mouth. So when we lighten that up, when we free it up with the Botox, it allows the corner of the mouth to lift up a bit and not have a permanent sad face. And it can actually help a little bit with that Marionette look and that kind of jowling that happens here as well, as again that tissue is kind of pulled up because it's not being pulled down by the DAO. The normal action of the DAO is that because it's pulling down the corner of your mouth, it helps you kind of frown, you know, like when we do this action. So you're not going to be able to frown as well. Boo-hoo. Okay, pun intended. But yeah, you won't be able to frown as well. Fair warning, when we treat this muscle, there is a small risk of affecting an adjacent muscle, which is called the depressor labii inferioris. That muscle pulls down the lip. Okay, so like the inner part of the lip. And when that muscle is affected inadvertently by the Botox, then it's typically on one side, and then that one side, because that muscle is pulling down your lip, it's not allowed to be pulled down. So that side is gonna sit higher, and then the side that's not affected, that's normal, is still gonna be working. So you're gonna have a bit of a crooked smile, okay? Typically that doesn't last too long. It's maybe on the order of a month, maybe a little bit longer, but it can definitely be bothersome. Sometimes we can fix that with treating the other side DLO a bit so they're both kind of even. But yeah, that's not really a side effect people love. It might be worth it to you to take that risk if you want to treat that DAO. It is very small risk, like I said. It's not very common that it happens, but it can happen. And then the last place that I love Botox that not a lot of people talk about is in the neck. How do we use it in the neck? So a couple of ways that we use it, or a couple of reasons I should say. We usually typically treat the same areas when we're doing the neck, which is treating those platysmal bands. Let me see if I can make them for you. It's like when you make this face and you see those bands, there are usually 4 of them, 2 in the front, 2 on the sides. You might have all of them or just 2 out of the 4, etc. when you make that face, but some people just have those bands prominently just walking around. And when we treat those bands, it helps soften those, okay, so that the neck doesn't look kind of like as sinewy. But another thing it does is that it helps prevent kind of the crinkling of the neck when those muscles are contracting, that platysma muscle. It is causing a bit of crinkling to the neck. So it can help give a little bit of a smoothing effect to the neck. Again, it is not like having a neck lift and having everything smoothed out. It's not like that. But again, when you look at it as, I'm gonna get a subtle improvement here, and potentially it's going to help prevent the worsening of that crinkly neck if we're also taking other measures like using good skincare on our neck and protecting from the sun. And then when we use it adjunctively, that meaning in addition to other treatments for the neck to help stimulate collagen, whether that is microneedling or radiofrequency microneedling or a laser resurfacing, whatever it is for you, in conjunction with that neck Botox, you can get an even more significant, noticeable, beautiful effect. Okay, so that is a great way to use it. Another thing I will say, you can get a little bit even more enhanced effect from your Nefertiti lift if you're also treating these vertical bands as well, because then you're kind of treating the whole muscle that's pulling down, not just this upper part. So it does take quite a bit of dosing there, like a good number of units to treat the bands, typically at least 20 units for all 4 bands. So the price can kind of add up, but again, for some people it is 100% worth it. And then you may also see with that treatment a slight improvement in those horizontal neck bands, what we call tech neck, maybe a little bit. Again, it's because it's reducing that kind of scrunching effect, so maybe reducing that creasing a bit. But again, I would not do it just for that. If you notice a bit of improvement in those lines when you're treating those neck bands, great, but I wouldn't go in expecting it. There's a whole other slew of treatments that we can do for those neck bands. I can do a separate video on that because I know that's a big problem for a lot of people and people hate it. But yeah, those are the treatments that I would say are super duper underrated, super under talked about. And I do find that when a lot of people come into the office for Botox, they're typically asking for it for certain areas, like, can you do my forehead? These lines bother me. And they don't really know that they actually can have Botox in other areas of their face or their neck that can actually benefit them. So this is really helpful if you have any of those issues, if you have a little bit of mild laxity, if you see those horizontal lines under the eyes, if you want a little bit of a brighter eye and opened up brow, etc. If you have a little bit of downturning in the corners of your mouth or those neck bands or a lot of crinkling in your neck, then this can definitely be helpful for you. So make sure you ask about it at your next dermatologist appointment if these things bother you. And I will say not everybody is a great candidate for all of these treatments, so it is important to get some personalized guidance here, but hopefully this is a good start for you. And from here, you can get some more tailored advice for your own personal situation, okay? And if you have any questions, pop them in the comments. If you're not subscribing, please do. I would love to have you. And if you like this video, if you made it this far, hit that like button so that more people would see it and you can spread the love. Okay, great chatting. We will talk next time.